Some children are born different, not because of myths, not because of stories, but because of extremely rare biological conditions. Around the world, a few kids are born with features so unusual that even doctors are left in disbelief. These are not legends. These are real children with real lives and real medical explanations. Today, we explore the rarest kids born with extraordinary features and the science behind what makes them truly one in a million. Are you new in this video? Click subscribe and hit notification bell. So let's get started. Katie Renfro is a young girl from Paxton, Florida, USA, who was born with a highly unusual and rare medical condition that has puzzled doctors and captured the attention of people worldwide. From before her birth, when doctors detected abnormal growth in her brain during pregnancy, her life has been marked by challenges most children will never face. Medically, Katie was diagnosed with megalencephaly, a rare growth development disorder where the brain is much larger than average. Megalencephaly can affect not just the size of the brain, but also the development of the face and skull, leading to unique features and medical complexities. But even with this diagnosis, Katie's doctors say her condition doesn't fit neatly into any known category. Despite extensive testing, specialists have not been able to pinpoint a single diagnosis that explains all of her symptoms, and some doctors have noted her case may be so rare it could be considered one in a million. Throughout her life, Katie has undergone numerous surgeries, including early brain surgery, tonsil removal, feeding tube placement, and several facial procedures, all aimed at helping her eat, breathe, and grow as comfortably as possible. Katie faces daily challenges. She uses a feeding tube for nutrition, experiences seizures, and doesn't walk or speak like many children her age. Yet her family says she has a vibrant personality and an infectious laugh, proving that despite the medical hurdles she faces, her spirit remains strong. Today, her condition remains medically undetermined in its entirety, but Katie continues to live each day with joy and resilience, surrounded by her loving family and siblings. Her story is a reminder of the extraordinary complexity of the human body and the profound strength of those who live with conditions that science still strives to understand. Charlotte Garside, often called the smallest girl in the world, was born with an extremely rare form of primordial dwarfism that left doctors unsure if she would even survive infancy. When she was born, Charlotte weighed barely more than a loaf of bread and was so tiny that she could fit in the palm of her parents' hands. Because her condition was so rare and poorly understood, doctors could not give her family a clear diagnosis or a prediction of how long she might live. Despite her fragile size, Charlotte grew up with a strong personality. Standing only around 27 inches tall as a young child, she faced daily challenges: weak muscles, a delicate immune system, and the constant need for medical supervision. But she refused to let her small stature limit her spirit. Her parents described her as bold, curious, energetic, and full of life, a child who loved playing, exploring, and learning just like any other kid. Charlotte often captured worldwide attention because of her appearance, but her family made sure people understood that she was more than just the smallest girl. She was a fighter with a bright mind and a fearless attitude. Though her body was tiny, her courage was enormous. Charlotte Garside's story remains a powerful reminder that strength is not measured in size. Even the smallest person can inspire millions with determination, resilience, and a heart full of bravery. Samuel Mann was born with thanatophoric dysplasia, a rare and typically fatal form of dwarfism. Doctors told his parents he likely wouldn't survive more than a few months. But Samuel had other plans. Now, at 11 years old, he's defied every expectation. He stands just 26 inches tall, weighs 25 pounds, and radiates joy wherever he goes. Though his condition makes everyday life more challenging, Samuel's spirit shines through it all. At birth, he relied on machines to breathe, but today he breathes on his own, something once thought impossible. He continues to inspire not just his family, but people around the world who hear his story. Thanatophoric dysplasia is incredibly rare, affecting roughly 1 in 20,000 to 50,000 births, and very few children survive long-term. But Samuel is a miracle, a living reminder that even the rarest diagnoses don't define a person's potential. He may be small in size, but his courage and smile have made a massive impact. Samuel Mann truly is one of those people born only once in 1,000 years. Isla Kilpatrick-Screeton is a young girl from Leicester, England, who has captured attention around the world for living with a condition so rare that she is believed to be the only person ever diagnosed with her exact form of Benjamin Button disease. Medically, Isla's condition is linked to an extremely rare genetic disorder known as mandibuloacral dysplasia, a form of progeroid syndrome that affects the development of bones, skin, and fat tissue, causing her cells to age and function in an unusual way. Genetic tests showed a unique mutation not seen before in any other known patient, which makes her case 1 in a million in medical history. Born in February 2017, Isla faced immediate health challenges. Doctors struggled to keep her airway open, and she spent her first days in intensive care. Her parents, Stacy and Kyle, would later discover just how complex her medical journey would be. Her condition affects multiple systems of the body. She has a narrow airway, trouble with breathing, and underdeveloped jaw and collarbone bones. She cannot eat on her own and requires medical feeding assistance, and communicates mainly through simple words and sign language. Doctors told her family that because her mutation is so unique, there are no known treatment protocols or long-term prognosis available, leaving many answers still unknown. Despite all the challenges, her family describes her as a happy little girl with a strong spirit, and they are working to raise awareness of her condition in hopes of helping others and advancing understanding of this ultra-rare disorder. Olivia spent years feeling unwell, battling unexplained sickness that left her weak, frustrated, and searching for answers. For most of her life, doctors struggled to understand what was happening to her body, until at the age of 18, she received a diagnosis that finally explained her symptoms. Gastroparesis, a rare condition where the stomach's muscles don't work properly, causing severe delays in emptying food from the stomach. Gastroparesis, sometimes called stomach paralysis, means that food moves extremely slowly, or not at all, from the stomach to the small intestine. This can lead to nausea, vomiting, difficulty eating, malnutrition, and chronic pain. Because her stomach cannot process food normally, Olivia's daily life was disrupted. She struggled with eating, keeping down nutrition, and the ongoing uncertainty of a condition that left her body unable to work as it should. For many patients like Olivia, the path to diagnosis can be long and confusing. Doctors often use specialized tests, such as gastric emptying studies, to rule out other causes before confirming gastroparesis. There is no simple cure, and treatment focuses on managing symptoms, dietary changes, and sometimes medical interventions to support digestion. Olivia's story is a powerful reminder of both the complexity of rare medical conditions and the resilience of those who live with them. Her diagnosis brought clarity, but also a new chapter of adapting to life with a chronic gastrointestinal disorder, one that millions around the world are still working to understand and treat. Neve and Nelly, often reported as Neve and Nelly Cholestein, are an extraordinary pair of craniopagus conjoined twins, one of the rarest forms of conjoinment in the world, where two individuals are joined at the skull. Born in Suriname and later growing up in the Netherlands, the sisters have lived with their heads fused together and a shared artery that makes medical separation impossible. Doctors once told their family that they might not survive infancy or reach childhood, yet they defied overwhelming odds and continued thriving into adulthood. What makes their story especially remarkable is not just the rarity of their condition, but the way they've embraced life with courage, creativity, and independence. Because of how they are joined, Neve and Nelly can never see each other face to face directly, and must rely on mirrors to glimpse one another. a fact they've turned into a symbol of their unbreakable connection rather than a limitation. Despite early predictions that their lives might be short or filled only with struggle, the twins refused to let medical labels define them. They learned to walk together, coordinate movements, and build their own personalities. They also chose to share their lives online, starting social media channels and even a YouTube presence to show the world that they are much more than their condition. They're young women with passions, humor, and dreams like anyone else. Neve once explained that each twin has her own thoughts and individuality, dispelling common misconceptions about conjoined twins reading each other's minds. Their story challenges the way people view disability and inspires others with how they take life one day at a time, proving that physical differences do not define the richness of human experience.
Gilang Andika was born on May 7, 2018, in Batam, Indonesia, via cesarean section. He presented with a highly unusual condition: a single body, but two distinct faces and two brains within one skull. Doctors attribute his condition to an incomplete split of an embryo in a twin pregnancy. One twin failed to fully develop its own body, resulting in craniofacial duplication, diprosopis. This condition is extraordinarily rare, occurring in approximately 1 in every 250,000 births. Gilang also suffered from hydrocephalus, a potentially fatal condition characterized by fluid accumulation in the brain. Because of his unique anatomy, Gilang could not breastfeed and was fed through a tube. Despite having a functionally normal body in other respects, his condition posed severe limitations, and local doctors indicated that they were unable to perform corrective surgery. Gilang's parents, Erlina Sari and Mustafa, sought help for surgical intervention, not only because treatments were risky, but also prohibitively expensive. They hoped for governmental or philanthropic support to save their son's life.
Karan Singh first captivated media attention when he was measured at 6 feet 6 inches, or 198 centimeter, around age 8, earning widespread recognition as the world's tallest 8-year-old. He hails from Meerut, India, and his remarkable height at such a young age sparked intense curiosity about his growth, health, and life as a child in a body unlike that of his peers. Karan's extraordinary growth has often been linked to genetics, given that exceptionally tall stature appears in parts of his family. But beyond the numbers, his life offers a real look at the challenges and public fascination that come with such a rare physical condition. As his photos and videos circulated, people wondered, how do you walk through school, social situations, and daily routines when you tower over even many adults? In the years since, Karan's height has continued to draw attention. Some social media posts and forums report that by his mid-teens, he may have reached around 8 feet 2 inches, though these later figures are less rigorously verified. Recently, Karan made headlines again after meeting the legendary WWE star Great Khali. At that meeting, the wrestling icon said it was the first time he had to look up at someone, indicating just how towering Karan has become. Karan Singh's journey invites us to reflect not just on what's physically possible, but also on how society views difference, curiosity, and the strength required to live a life so visible, literally and metaphorically.
Meet Ayla Summer, a baby girl from Australia who was born with a smile that instantly captured hearts around the world. From the moment she entered the world in 2021, her parents noticed something unusual. Ayla's tiny face carried a constant, radiant grin. Doctors quickly explained that this was due to a rare condition called bilateral macrostomia, where the corners of the mouth don't fully fuse during development in the womb. This condition is so rare that only about 14 documented cases exist worldwide. While it may look surprising at first, Ayla's condition doesn't stop her from being healthy, happy, and full of life. In fact, her smile has become her signature, turning what some might see as a difference into something extraordinary. When her parents shared her story online, millions of people were touched. Photos of Ayla's big, beautiful smile spread across social media, with people calling her the baby who never stops smiling. Many even said her smile brightened their day, proving that uniqueness can inspire joy. Though she may undergo corrective surgery as she grows older, for now, Ayla continues to spread happiness everywhere she goes. Her story is a reminder that even the rarest conditions can reveal incredible beauty. This is Vanelope Hope Wilkins, a baby girl from Leicester, UK who made medical history when she was born in November 2017, with a condition so rare that most children don't survive. She had ectopia cordis, which meant her tiny heart was beating completely outside of her chest with almost no bone to protect it. Doctors detected the condition during a 9-week scan, and her parents were told survival was nearly impossible. Many advised them to terminate the pregnancy, but they chose to fight for their daughter's chance at life. When Vanelope was delivered by C-section, she was immediately placed in a sterile plastic bag to protect her exposed organs. Within an hour, a team of 50 specialists began an extremely delicate operation to slowly move her heart back into her chest cavity. Over the next few weeks, she underwent 3 major surgeries, expanding her chest space, reconstructing tissue, and carefully covering her heart with skin. Each procedure carried enormous risks, but Vanelope fought through them all. Today, Vanelope is celebrated as the first baby in the UK to survive with this condition. Her story is more than a medical miracle. It's a symbol of hope, determination, and the power of never giving up. Meet Zoe Lush, a brave girl from Huntington Beach, California, born with a rare and severe form of osteogenesis imperfecta type 3, a condition so fragile her bones would break in the wind from the slightest pressure. From her very first moments, Zoe's life was marked by fragility. She fractured her collarbone during birth, and by her first few weeks, she'd broken both arms and a leg. Over the course of her first year, she endured nearly 100 fractures. Despite these overwhelming physical challenges, Zoe's spirit remains unbroken. She communicates with sign language and brings warmth and humor into every moment, even when most would expect her to be in pain. Thanks to community support through initiatives like rodding surgeries, which insert expanding metal rods to reinforce her fragile bones, Zoe has shown amazing progress. She's even learning to sit, crawl, and reach for the world around her. Though each move carries the risk of another fracture, Zoe's determination shines through. Her life isn't defined by her breaks. It's defined by her boundless resilience, her family's love, and a spirit that refuses to be contained.
Petero Byakat is a young boy from Uganda whose face became dramatically distorted due to a severe congenital facial tumor, believed to be linked to a lymphatic or vascular malformation, conditions where fluid-filled or blood vessel-related growths expand uncontrollably in the soft tissues of the face. These types of malformations are extremely rare in children, and when left untreated, the growth can rapidly increase in size, causing major functional and emotional challenges. Petero's condition began developing when he was very young. As the tumor expanded, it caused large swelling around his cheek and jaw, making it difficult for him to chew, speak, and even close his mouth properly. The size and weight of the mass also affected his breathing and facial symmetry, drawing unwanted attention wherever he went. Despite the discomfort and social stigma, Petero remained strong and continued attending school, supported by his family who desperately searched for medical help. Because advanced surgical care is limited in many rural parts of Uganda, Petero's tumor continued to grow until his case drew international awareness. Medical professionals recognized that his condition required specialized surgical intervention, including the removal of the mass and reconstruction of facial structures. Such surgeries are highly complex due to the risk of bleeding and nerve damage commonly associated with lymphatic and vascular malformations. Petero's story is more than a medical case. It is a reminder of how geography and access to healthcare can profoundly shape a child's life. His bravery and his family's determination to find treatment inspired many organizations and doctors to step forward and provide the care he urgently needed.
Zion Harvey was just 2 years old when a deadly infection changed his life forever. He developed sepsis, a severe illness that forced doctors to amputate both of his hands and feet, and later, he needed a kidney transplant, donated by his brave mother. Most kids would have been crushed, but not Zion. Even without hands, he learned to write, eat, play video games, and run with prosthetic feet. His spirit was unshakable. Then came something truly historic. At just 8 years old, Zion became the first child in the world to receive a double hand transplant. In 2015, a 40-person medical team at the Children's Hospital of Philadelphia spent 10 hours attaching donor hands to Zion's arms. It was a risky, groundbreaking surgery, and it worked. Just days later, his new hands turned pink. Blood was flowing. And over the next few months, Zion stunned the world. Through intense therapy, he began moving his fingers, feeding himself, tying his shoes, and even throwing a baseball. His brain, which had adapted to life without hands, retrained itself to feel and control the new ones. But what truly amazed everyone was Zion's attitude. He once said, "I'm still the same kid you knew before, but now I have hands, and I can do everything better." He even threw the first pitch at an MLB game, hugging his mom afterward with the hands he never thought he'd have. Zion Harvey's story isn't just about medical miracles, it's about courage, second chances, and the strength of a child who never gave up.
Not every extraordinary story is fully understood. Behind every rare feature is a real child, with a real life beyond what we see on screen. If this video made you curious, thoughtful, or aware of how diverse the human body truly is, take a moment to support the channel. Subscribe for more real stories, rare human cases, and facts the world rarely talks about.